Hello, I'm Corey Walker. I'm one of the spine surgeons here, part of the Department of Neurosurgery at Cedars-Sinai Medical Center in Los Angeles. I'm going to be talking to you today about what is disc replacement and when do we use it and what it is in terms of spine surgery. Oftentimes with spinal disorders, patients can have degeneration of the discs in their spine. The discs in the spine are the shock absorbers that occur between each of the vertebrae throughout the cervical, thoracic, and lumbar spine. These shock absorbers that we have lose their water content as we age, and they can degenerate and lose their ability to absorb your weight and the forces that your body puts on the spine. In times where we need to operate on these, in cases of nerve impingement, severe pain, spinal cord compression, one of the things we try to do is maintain motion across the segment. Traditionally, we would take out the disc and get the two bones above and below to grow together in what we call spinal fusion. Oftentimes this is still required in a lot of pathologies. However, especially in younger patients, we try to preserve motion. The reason we do this is it takes off the amount of force that gets acted upon the levels above and below the spinal fusion by maintaining motion at the operated level. The reason we do this is because we want to preserve the function of the spine and to avoid wearing out those levels above and below where we're operating. We know that from long-term studies that you can still have degeneration at the segments above and below. However, this reduces that risk long-term. In the cervical spine, where we most commonly perform disc replacement, the procedure itself is from the front of the neck. Essentially what we do is we make an incision horizontally in the front of your neck in a neck crease. We push over your esophagus and trachea to the side to encounter the front of the spine. At that time, we'll take out the disc between the two vertebrae that's the problem. We'll scrape it out and take the pressure off the nerves in the spinal cord through that disc base from the front. Because we've taken the disc out, now we need to either fuse and put in a spacer so that those two bones will grow together, or, as they do in hip and knee and shoulder operations, we can put in an artificial disc which performs the replacement procedure. Here we have an example of a disc replacement device. This disc replacement, as shown in this little model between these clear vertebrae, the metal is the implant that we would place in that specific disc base. This is an example of one of the companies that makes a disc replacement by Orthofix that allows you to maintain motion across that disc space and allow for rotation there and flexion extension, like this, of your neck, despite needing to remove the disc. After surgery, patients with disc replacements are able to get back to their normal daily life. As disc replacement technology has advanced and our understanding too has advanced, disc replacements are now being used more commonly even in professional athletes and people with high levels of activity, as we've figured out that the safety of these devices is very great and the longevity of these devices, just like in the knees and hips, is long-lasting. So in select patients, it's important to consider disc replacement whenever we can maintain motion of the spine and help preserve the long-term function of people's spines and to get them better and recover quicker.